Hello, everybody. For my internship for my public health internship class at the University of Arkansas, I did it through ARCare this summer. So the agency I used, which stated before, was ARCare. My name is Joshua Kennon. I'm the intern, and my main preceptor was Lauren Fields. But I also followed other people in ARCare's staff, which included Jennifer Miller and also Broderick Eaton. So this is everything about ARCare. So ARCare's mission statement is health for all. They are very focused on providing health for communities all across Arkansas, Kentucky, and Mississippi, as they have clinics in all three of the states. Their biggest amount of clinics, though, is here in Arkansas, and they are federally funded. So they write grants, and the federal government provides them with money to be able to pay for the health care for a lot of people that can't afford it. Their vision for the company is to become the largest healthcare provider in the South. So to do that, again, they want to be able to bridge gaps in the low socioeconomic areas of the South, because there are so many in the rural areas and everything, that is their main goal. They are trying their best to do that. Again, their target populations are all across the South, mainly focusing on providing affordable healthcare for families of low socioeconomic status. So they're doing everything they can to provide affordable health care to people who truly can't afford it, because they can't afford things like insurance and things like that. So they see a lot of Medicare and Medicaid patients. My preceptor, as mentioned before as well, is Lauren Fields, and she is the Chief Nursing Officer at ARCare. So here's an overview of my project. Image on the right is a picture of Cologuard with some steps along with how to use it. So the project I was tasked with as an intern was helping find ways to increase colorectal screening among ARCare patients. So this was an issue they were seeing that they had of there were patients not getting screened, and it's very important for them to get screenings done through their patients, because that is how they get more grant money from the federal government to be able to provide this health care for these patients. The main reason for this was the percentage, again, like I said, was very low. I think it was around 38% whenever I started this summer. I think it's increased to about 43 as of now, but we're hoping to see that continually to increase. The goal in this was to increase the awareness of Cologuard and how easy it can be to use compared to colonoscopies. Because a lot of people, whenever they think colorectal screenings, they think about, I have to go to the doctor, I have to prepare myself, I have to fast, I have to do all these things that are very inconvenient. With Cologuard, it's not that way at all. It's just you are at home, you use the bathroom, take a stool sample, and mail it in. And if they see anything that looks eerie or wrong, then they'll contact you about coming to get a colonoscopy just to be sure. But if not, then you're good to go. So the steps that I personally took to increase screening was, first of all, I started the summer doing in-clinic and out-of-clinic research. So I followed doctors around in-clinic, I followed nurses around out-of-clinic or in-clinic as well, and just seeing patients, understanding why they were choosing not to get screened and things like that. And what we ended up figuring out was it was mainly a people group, mainly African American males were the hardest people to get their screening done. And we're not for sure exactly why that was. We think it comes to they think they don't need it, or they might be a little bit embarrassed. We don't know for sure, but that was the main group. So the second thing I did was create RAC cards. So these RAC cards are just short and simple cards that you put information on that are easy to read. I put on a 4th to 6th grade reading level, because the education tends to be lower here in the Delta where I'm at and where a lot of these clinics are at. And since that's the case, it makes it easy for the patients to read that really truly need them. And I've taken them to clinics and passed them out in other areas. I also created a script that doctors and nurses can use that, again, is on a 4th to 6th grade reading level. That way, when they're communicating with patients, they're not using words that their patients can't understand whenever they're trying to get them to use Cologuard for colorectal screenings. I then delivered the cards to local clinics and communicated with patients on the importance of colorectal screenings. So I would follow doctors around, and if these people hadn't been screened for their colorectal things, then I would talk to them after the doctor ended up being done talking to them, and just kind of be like, hey, here's some information about Cologuard. Here's how easy it is to use. You should really look into it. Here is the example of the RAC card with all the information that I made. Just simple, short, sweet, very to the point, shows the benefits of Cologuard and how easy it is to use. So here's the NHEC competency improvement that I personally had. So for me, area one was one that I focused on, which is assessment of needs and capacity. The subcompetency being identifying primary data, secondary data, and evidence-informed resources, which is part was during the first part of summer for me, whenever I was doing a lot of research, gathering data, and things of that nature. Area three was the next area that I increased on or improved on, which was implementation, and the subcompetency was deliver health education and promotion design. So that was through me creating the rack cards and me creating the script and then delivering that. And I designed all of it, and I made sure it was in a very understandable way for these patients that truly needed to understand what was being said in these things. So the review of the experience, how I benefited was, again, I learned about coordination of care, how to contact multiple people across our care, figure out the best way to do these things. I talked to researchers, I talked to nurses, I talked to doctors, all these different things I had to do, and then kind of coordinate what everybody was saying to build my project off of. I learned communication abilities, again, through that communication with all these different people. And I learned responsibility because my preceptor helped guide me, but a lot of times she was like, hey, I just need you to do this, and you're kind of on your own, kind of figure out how to do it, but I'm here if you need help. And so she was very helpful in that aspect, but she also gave me some freedom to be like, hey, you're a big boy now. You can do this. You can figure it out on your own, which I was very, very grateful for. And how the agency benefited, again, they gained free help to their goal to increase colorectal screenings, which at the end of the day will help them gain more money from the government to be able to provide more free health care for people that truly need it, that can't afford it, that are on Medicare and Medicaid and other things of that nature. And here's a summary of our care. This is its location, their phone number, again, the preceptor and key staff, which was Lauren Fields, Brody Eaton, and Jennifer DeWitt, and their website is there as well. I would totally recommend this site to anybody. It was great. It was awesome. Everybody was very friendly. So, yeah.